The following episode of Southern Remedy deals with the subject matter of HIV/AIDS in Mississippi and contains information that some viewers may find graphic. It's intended for mature audiences only. Viewer discretion is advised.
Today is actually to tell my testimony, my story on how to maintain a healthy lifestyle with HIV.
It's a diagnosis that is charged with so much, stigma.
When we start to talk about sex, the church clams up, the family clams up.
It could have been me that infected him, or it could have been him that infected me, because neither one of us were virgins.
Hello and welcome to Southern Remedy. I'm Dr. Rick DeShazo.
And I'm Melissa Faith Payne. HIV is said to be an epidemic in Mississippi. Health Department reports state that African American males are the group hardest hit by the virus, and the highest number of new cases are reported in 13 to 29-year-olds.
I'll talk with health professionals addressing this issue, and we'll hear from community leaders addressing the problem.
First, we'll meet a young man who says he contracted HIV through unprotected sex and learn how he is coping with his condition.
My name is Marcus McPherson. I'm 29 years old. I'm currently a graduate student at Jackson State University. I'm studying public policy and administration. I've been HIV positive for 2 years now. It was just a regular, normal, what I thought to be normal test. I went to the clinic and got tested, Crossroads Clinic in the medical mall. Got tested because I hadn't been tested in a while and just decided to stop in and get my checkup, and that's how I found out. I had been getting tested before I moved back to Mississippi, but once I moved back to Mississippi, it kind of lapsed for probably about almost a year. I was shocked. It took me a while to process it. I was smiling and everything with the nurse at first, and then it was like as soon as the nurse left out of the office, I just broke down into tears, and I had to just sit in the little exam room just for a while before I could even leave and go home. I gained my composure just enough to leave out of the doctor's office and get to my vehicle. I basically sat there in the parking lot for about 20 minutes before I could even put my key in the ignition and start it up to drive off to even call anybody. And the first person that I thought to call was my best friend. I told him that I was HIV positive. I just found out. He reassured me that everything was gonna be okay. He just wanted to make sure that I was doing okay, and after talking with him for a little while, I was finally able to regain my composure and eventually drive home. My parents are married. They have been married for at least 40 years now. So I actually have two older brothers. One passed away a few years ago, so that made me and my oldest brother real close after his passing. So he was actually the first person in my family that I told. And then afterwards, I think it was probably after 6 months or so that I told my parents, because the main thing on my mind, I did not want them to worry about me, because I knew that they had already lost one child. I didn't want them to think that they were gonna lose another child. My brother was shocked at first, but he saw that I was managing my care. I was going to my doctor's appointments. I was taking my medicine like I should and everything. So he got over his initial shock very quickly. My parents, on the other hand, they were kind of upset a little. My mom cried. My dad was like, "Son, you're gonna be okay. We're here for you if you need us." And basically, they have played a supporting role. I've started a strict diet, a vegetarian diet. Basically, it's eating healthy, exercising, taking my medicine. The same thing that a lot of doctors tell their patients, I make sure that I follow. There's a lot of people look at me and say, oh, it's because of your diagnosis that you lost weight. It's actually not that. I lost weight on purpose because, diabetes runs in my family, high blood pressure runs in my family, high cholesterol runs in my family. I had a brother who passed away from a heart issue, and I'm just trying to make sure that I take on a healthy lifestyle. I want to live. That's my main thing. I don't want to be the person that dies early. I guess it kind of cemented when I first found out I was positive. I met a lot of people through a support group here in Jackson, and over the short period of time, several other guys that I met when I first started going to those support groups have passed away because they were not taking care of their health. And that is one of the things that has kind of shocked me and made me really focus on taking care of my health care and making sure that I do what I need to do to stay around for 20, 30, 40 years and have a long, fulfilling life.
According to Mississippi public health official Dr. Nick Mosca, African Americans in Mississippi are profoundly affected by HIV. Dr. Mosca talks with Dr. Rick about these statistics.
Now, we're here today to talk a little bit about what's going on with HIV in the state, because there's been a lot of stuff in the press and otherwise that things have changed, that there's an epidemic of HIV and African Americans, and we have a lot of African American citizens here in the state, and that they're disproportionately affected by this. Is that true?
When we look at our data for positivity, people that have tested positive for HIV, 3 out of 4 of those infections occur in the African American community. So yes, the African American community is disproportionately affected, I would say profoundly, by HIV in the state. Is it a new occurrence? No. If you look at the last 10 years, the African American community has been disproportionately affected by HIV.
So this is another health disparity that African Americans have to deal with all the rest of them?
Yes. And one thing that underlies the health of African American communities is the context. It's the communities that they live in. People that are living in counties that have high poverty rates, high unemployment rates, are going to have a greater burden of disease and poor health outcomes. People that have difficulty accessing healthcare systems, if they live in parts of the state without a hospital nearby or a physician, they're going to have a greater burden of disease. And then finally, there are things like high criminalization, other things that affect communities disproportionately living in poverty.
Well, we've talked a little bit about this epidemic disproportionately affecting African Americans, but it also seems to be picking out a subpopulation of African Americans who are more affected than others, and surprisingly, it's a young population.
Yes. In recent years, there's been an increase in cases of HIV infection among teenagers. Probably the greatest spurt of infectivity has occurred between the ages of 13 and 24 years of age.
This breaks my heart, and this is happening here in our state.
Yes.
Why?
There are, I'm sure, a variety of factors that have influenced this. It's important for people to understand how HIV spreads. It does not spread casually. It doesn't spread by sneezing or, sharing an eating utensil or kissing. It shares through intimate sexual contact, typically vaginal or anal sex. Much more rarely oral. It's not completely without any risk, so I have to mention oral sex. It can also spread through needle sharing, and it can spread from an infected woman to her fetus.
So I think it was in 2010 when President Obama got hold of these statistics that we've just talked about, when all this became more apparent. In Mississippi, it was already going on, as you said, but at a national level and put some new money and some new energy into trying to make sure people were screened who were in risk groups and that they got to treatment as quickly as possible. And there was a lot of prevention done. Did any of that money or any of that energy get down to Mississippi?
The energy did, and a little bit of the money too, and I'll explain. The national strategy means that we need to focus on the communities that are most impacted. So we are trying to work more in the Mississippi Delta region because that community reflects, if you rank communities that have HIV infection, there's a large proportion of cases in that community. If we want to encourage people to get tested, our campaign's called Be Positive, You're Negative. We also, though, to comply with the national strategy, need to get people into treatment. And that can be a little bit more challenging because we need infrastructure to do that. But we are looking for primary care doctors in the state that are willing to accept HIV care in their practices. We have a limited number of doctors now who have been serving the state for quite some time. And some people think the health department actually provides primary care, and we don't. You know, we don't do any primary care. So if there's any physicians in the state that would like to, you know, become a provider for this illness as well, then we definitely would like to train them and provide some
It looks to
mentorship.
me like the primary care physicians, of which I'm one, have sort of dropped out of the picture and deferred to the infectious disease specialists, but we don't have enough infectious disease specialists to even take care of the metropolitan areas, much less all these rural areas.
No, and you know, the other thing now is, you know, 30 years of dealing with this epidemic, I think that it's easier to manage HIV disease. I think maybe early on there was so much uncertainty that the specialists were really pivotal. But now it's very similar to other chronic diseases like diabetes. You know, it requires prescriptions, it requires monitoring, but people live a very long life now. And the only way that we'll be able to expand access to care is through increasing the provider population and also increasing the financing options for care, because nobody will provide care for free.
And that's always been the issue here with public health, hasn't it? You guys get your funding primarily from the federal government, because I understand we have the lowest per capita support of public health here in the state from the legislature than just about any state in the union. So you're constantly writing grants to get funding, and HIV just keeps going on, but the grant funding shifts from HIV to heart disease to so forth, and you're stuck with the same chronic problem that's going on. Do I have that wrong?
You know, we do get almost all of our funding for sexually transmitted disease is coming from the federal government. In recent years, we've had a requirement where we have to provide a match, meaning we have to get non-federal dollars. We have to get a proportion of non-federal dollars to match some of our federal money that we get for HIV treatment. So we have had an appropriations from the state legislature, but it's a small amount to help us with that match. But it's not the full match. We still have to look for other sources of funding to match the federal money that we get for treatment. And so it is a challenge for us.
At first, they were in shock, sort of like I was, in disbelief. And now my family is kind of like Sylvester's mom. They're worrying about me. They're always saying, well, you okay? You feeling okay?
It's more like a family instead of a group, just a group of guys that come. We do invite new guys in, but with, you know, HIV, you still got that fear factor. You know, even though I'm HIV positive, you come into a meeting where everybody else is HIV positive, but you're afraid of who you might see.
How's everybody doing?
One of the things that was evident is that HIV prevention, providing access to prevention and care services, you know, to the people who were most affected by HIV was important. And in some of our studies, we found that not having health insurance was actually a significant risk factor for HIV infection. That not having a primary care provider was a significant risk factor for HIV infection. That even if you, as a gay man, went to a primary care provider, not being able to disclose your sexual orientation was a risk factor, probably because people was not able to receive any kind of HIV prevention education. And so it was kind of evident that as a solution, one of the solutions to, or one of the ways to address this HIV epidemic and the STD epidemic was actually to provide access to clinically and culturally competent healthcare services. So that's kind of the reason why I've been involved in the past 2 or 3 years, developing, helping clinicians and helping health centers to develop culturally competent services for LGBT populations, and certainly Open Arms is kind of the flagship, I guess, of that effort.
I've been HIV positive, knowing it for 9 years now. I initially found out in March of 2005, and probably wouldn't have gotten tested then had it not been that my partner of 6.5 years, he was, they did a blood drive at his job. So when his results came back, well, the blood, how they test the blood, they told him he needed to go get checked. So when he got checked, he was positive. So me being his partner, I had to go get checked as well. After I found out that my diagnosis was HIV positive, me nor my partner actually seek treatment. Basically, we ignored it, and I moved away. At this time, we was living in Texas. I moved away a few months later, moved to Memphis. And, while I was in Memphis, I was going to the doctor, but not for HIV. I'm a diabetic. So I was going to the doctor, and I never told them that I had HIV positive. They never tested me. And a year later, that's when I began to start feeling weak, losing weight. And it was June 6th of 2006 is when I got very, very sick and, came home. That's when I got a phone call that my partner had passed away.
We're talking about people who are young, who to a certain extent, until a few minutes ago, felt, invincible. And suddenly you're telling them, they have a disease or a condition. I try to avoid actually calling it disease unless they have any symptoms. A condition that is incurable. And, but also is a diagnosis that is charged with so much, stigma and blame. And they ask themselves, what I did to deserve this. So you have to help them to go through the process of dissociating or being able to identify the feelings that are associated with the fact that you're being told you have a disease. When you're 21, 22-year-old, and now you have a disease that you never thought you were gonna have. And second, what component of what you're feeling is actually derived from the guilt and the homophobia and things that you have actually learned, being, taught to you through your raising and the cultural context in which you grew up, that probably are going to become important barriers for you accessing healthcare and for you, staying in healthcare and being able to comply with your medical treatment.
Dr. Mina, he really made me feel comfortable. He let me know what's going on. I can always get in touch with him. He's not one of the doctors where it's impossible to talk to or get in touch with him. He really do help. My name is Antoine Matthews, attending Tougaloo College, majoring in biology. What I plan to do after college is be a healthcare administrator. I found out I was HIV positive April the 24th, 2013, so next month I'll make a year.
A few days later, I went to the hospital. They sent me home, and my mom came to Memphis and went back to the hospital, and that's when they kept me for 13 days. And about 3 days afterwards, the doctor came and told me that I had a fungus. I really don't recall what kind he said that was in my stomach, and it was the results of AIDS. While I was in the hospital and the doctor told me, he was like, we don't have to tell your mother. But I was like, we need to tell my mother, because I need prayer. So when my mother came back in the room and the doctor had left, and I told her that they found out what was going on, and her thing was, she always called me boy. So she's like, boy, you're gonna be okay, God got you. But she was always there. She stayed in the hospital the entire time I was there. When I got out, I remained in Memphis for a week, and then she came to Memphis and got me, and I stayed with her. And it was like it was like me being a baby all over again. She had to take care of me, and she didn't treat me no bad way other than just that. I just get emotional every time I tell that story, because I think about how what my mother did for me, and then a lot of the people that I encounter, how their family pushed them aside.
My dad is a preacher. When I told my dad, it did go through my head that he's gonna judge me and this and that, but at the same time, I was like, you're the man of the Lord, so you know the Bible, and judging is something that he really don't too much praise. So that's the reason I was like, okay, I'm gonna tell him. And when I told him, the first thing he was like, you know, this is a disease and you're gonna die and this and that, and so many words. That was how he was coming off. But I had to let him know that HIV is not what it used to be in 1980s. It's 2014, you know. It's that time when we finally realized that we can better ourselves if we take our medications and if we do all these things to stay healthy. If we don't, then that's when the numbers will change. So I had to show him, and when he get to talking negative, I would let him know God has the last say so. So right now I'm not really too much worried about dying, I'm talking about living.
My name is Javon Bean, I go by Zai. I've been HIV positive for 5 years. I actually been in a relationship with somebody for about 1 year and 7 months, and of course we getting tested and everything with each other, and basically we transitioned into not using condoms, and come to find out within, I said last month that we was dating, that he was cheating on me with somebody else and brought it back to me. I told my mentor and also my spiritual father, Cedric Sturtevant, and that was the first person I told. He could relate. He was in the same position as me, and then of course he told me several times, be careful, be careful, be careful, be careful, be careful.
He came to me and he told me that he tested positive for HIV. And it broke my heart, but I didn't let him know right then. You know, I just talked to him and I told him that, you know, we're gonna make sure he getting care. He's just like a biological son. You know, if ever I had a son, he's just like, but most of them are, you know. I get the same love from them that I get from my daughters, and my daughters are biological daughters. So, and they know the guys, they know their brothers, as they call them.
Mom, she hung up the phone basically after I told her. Didn't come back for a little while, but she finally called back, and we had really just talked about it. She just always say, take care of yourself. Dad, he had told me that he was going to get some burial insurance just in case I die. So, really and truly, just kind of I told you so kind of moment.
I couldn't imagine being rejected by my mother at all. Even when I told her that I was gay, I could not imagine if she would have rejected me, you know, I don't know. You know, but I just want people to just show more love toward each other, you know. If that's your child, you know, God bless you with that child. Love him or her, regardless of what goes on in their lives.
It's great to have Dr. Amy Nunn with us from Brown University. I understand you're assistant professor of medicine and public health.
Yes, sir.
At Brown University. What brings you to Mississippi?
Well, I've been doing HIV/AIDS research here for the last 5 or 6 years, and this week we are hosting a faith summit calling African American clergy together to speak out and to learn about the state's HIV/AIDS crisis.
So why are you directing your efforts to the faith-based groups in the state?
Well, the rates of HIV infection in Mississippi are alarming, and most new infections are concentrated among African Americans. Almost 80% of new infections in Mississippi are among African Americans, and we think it's really important to get faith leaders involved to help spread awareness about this crisis and also to promote testing and treatment.
So, what is the connection between the African American church and HIV that you're addressing? That's not one that we usually put together.
Well, as you know, there has been the African American church has played an enormous role in the civil rights movement and also provides a lot of important services in Black communities. A lot of African American churches also provide social and spiritual support for their communities. And we're really hoping to get pastors involved to help spread awareness and also to help embrace people living with HIV. A lot of the problem, I think, stems from the paralyzing stigma that is often associated with HIV. And what we're hoping is that if pastors come together, they can help speak out about this issue and really help raise awareness about the importance of getting tested and treated.
As you've said, the HIV epidemic started primarily in gay men, and then it went to heterosexuals, and now it's popped up again, and you're saying it's popping up primarily in African American gay men? Is that where it's popping up this time?
I think that nationwide, about half of new infections are concentrated among African Americans. The epidemics vary in different parts of the country. Some have a larger fraction attributed to injection drug use. There are very high rates of infection among young African American men in Jackson. Jackson has the second or third highest rates of infection among young Black men of any city in the country. I think it's second only to Memphis and maybe Houston. So we are seeing that the people who are getting infected have shifted over time. I think that's attributable to a couple of different things. A lot of this is related to this stigma. There's often a lot of stigma associated with HIV, and when there's a lot of stigma, people might be a lot less likely to get tested, or people may just have limited access to health services. That's the other thing, is if there aren't services in your community or you don't know that you might be at risk, you might be a lot less likely to get tested. We also know now that treatment is a really effective prevention intervention. Before, we knew that people living with HIV who took their medications could live long, healthy lives. But now we also know that if people are on treatment, it reduces the chances they transmit the virus to almost zero. So now we know treatment is prevention. However, a lot of people that are most likely to get infected may not even know they're infected, and so they may not be on treatment. So that creates this cycle of infection. So that's one reason it's so important to spread the word that everyone should get tested, irrespective of what they think their risk is or their risk behaviors, and to really also focus on some of the communities that have the highest rates of infection, like the African American community, like young Black men.
What has happened among this population of gay, young Black men that's different from any other explosion of this epidemic that we've seen previously?
So it's important to mention that African American men who have sex with men do have higher rates of infection than other populations, but the epidemic isn't only limited to them. In the 4 places where HIV infections are clustered in Mississippi, Jackson, the Gulf Coast, the Delta, and Hattiesburg, one of the common denominators there and across the country is that there are limited access to health services. You probably know, since you do so much work on healthcare and health services in your show, that Mississippi has weak health infrastructure, particularly in some of the rural areas. So part of the challenge is really raising awareness about this not being just a behavioral disease or something who affects people who are gay or men who have sex with men, is really framing this as a health services and access issue. And that's something that we've been trying to do in partnership with clergy as well.
So why is an infectious disease that is sexually transmitted a civil rights issue?
Well, we're 30 years into the epidemic, and I think we're in the middle of a social justice and scientific crisis. We have African Americans have 8 times the rate of HIV infection as whites, and African American women have 17 times the rate as their white counterparts. Those rates are alarming, and what's particularly surprising and is worthy of a lot more attention is that African Americans do not engage in any higher risk behaviors than people of other races. I want to say that again. African Americans don't engage in any higher risk behaviors than people of other races. There's a whole body of literature that has explored this, and this has been proven scientifically. The crisis is that we can't tell you exactly why people of color are disproportionately impacted. We have some pretty good hypotheses, like the things that I alluded to before about not having limited testing and treatment services. But in my mind, this is a civil rights crisis. People aren't engaging in any higher risk behaviors, and they're getting a lot sicker. I think the scientific community and the policy community really need to dedicate a lot more resources to unpacking this problem. And one reason I'm so passionate about engaging community leaders is I think that the solution starts with community leaders. It starts with community mobilization and getting leaders involved to help fight these issues. We know down to the census tract where people are getting infected, and yet we don't target our resources to those heavily impacted communities. If you go to a website called aidsview.org, you can see down to the zip code and census tract where HIV infections are concentrated in Mississippi, in urban areas across the community. And you see that HIV infections are clustered in communities of color and in poor communities. And the civil rights issue is that we are not targeting those communities with massive amounts of resources related to social marketing to promote testing, with testing services and treatment services. And I think not directing resources is a real civil rights issue. One of the things that has come out of my scientific research with clergy is that civil rights are a great way to frame this conversation with clergy. Sometimes conversations about health behaviors and human sexuality and homophobia in faith settings can be divisive. Some people don't want to talk about those things at church because some people believe it might be incongruent with the kinds of conversations that they should be having at church. Black pastors are often very willing to embrace conversations about civil rights. They're often very willing to talk about health disparities. They're also willing to talk about testing and treatment. And I think that's a good example of why it's so important to ask clergy, how do we frame these conversations? Because if we hadn't done that a few years ago, I wouldn't have known how to address these issues with clergy, but they told us. If we frame this as a civil rights issue, if we frame this conversation about testing and treatment, that's a message that works for me at church. That's a message that resonates with my congregation.
When I travel around the country and I see the data where you see the amount of blacks that have been deemed positive, HIV positive, or that have AIDS, and then you see how the resources are spent and how the health education is available, and you see resources spent more in areas where they are proportionally less, that becomes a civil rights issue, and that is something that we are partnering with the Healthcare Foundation about.
The ignorance that the church has had in the past of assuming that if we can point to someone's behavior as the reason for what they have, then all of a sudden we do not have to care or have concern for them, which I think is not biblical, which I think is not practical, and not what Jesus would do. And so today I tried to point out that even when Jesus encountered the man at the pool of Bethesda, that was a man who had done something to get there. But Jesus' first words to him were not words of judgment and condemnation. They were words that offered help. After he received the help, then Jesus gave him some words of how not to get there again. And that's the paradigm for the church. Help first, point in the new direction second.
Anytime you attach HIV and AIDS with any individual in Mississippi Delta, you're pretty much an outcast. So with that being said, what we're trying to do is just starting dialogue in the churches. Once we get the pastors to step out of their comfort zone and speak about sex and HIV and AIDS, then we can have more conversation on how to fight the disease. But until we do that, it's going to be hard to dismiss the stigma.
The pandemic of HIV and AIDS is significant and serious throughout the world, and it is critical in the African American experience and the African diaspora. So number one, we're doing what Jesus would do, because I think if you were to equate HIV with the leprosy of Jesus' day, we have to follow his example of how to deal with that. And so it is a major issue, and it's a major issue because it's also a very preventable disease if we will address both the personal responsibility issues and the systemic issues that lend themselves to us seeing where HIV is and how it is growing.
Well, there are definitely ways that Alcorn continues to teach people about getting tested, and there's a place on campus, but we want to help them make better ethical decisions, and if they do receive it, provide care and counsel for them.
We're doing different outreach in the community first with the Bolivar County Baptist Association. So we're going to start with those steps, and then we're going to go into the churches.
I do believe homosexuality is sin. My message to the people of faith is abstinence. Be faithful. My message to the people of humanity is, if you have another ethic, at least protect yourself so that you can protect the human family.
Dr. Alfio Raza has been in Public Health District 3 in the Mississippi Delta for several decades. He and Dr. Rick explore the particular challenges the Delta has with this public health crisis.
Now, let's talk a little bit about this outbreak of HIV, which I understand is one that has occurred throughout the country but is amplified in Mississippi, of HIV in African Americans, primarily African American young males. Tell us a little bit about what you're seeing.
Yeah, first, if you look at the population spread from little kids to old men, the most sexually active are that group 19 to 24 to 34. So, I mean, young, virile, out to have a good time, kind of business, invincible, it's never going to happen to me, kind of business. The issue is sexual activity. If you don't have sexual activity, other than for the unborn child, a pregnant woman that's got an HIV infection, you don't get it. When we start to talk about sex, I mean, the church clams up, the family clams up, the neighborhood clams up. I mean, it's a subject that for some reason everybody knows about, but nobody wants to talk about.
You didn't have this particular explosive increase in HIV in the Delta until recently.
Yeah.
It was controlled. So what were you doing? Have you stopped doing it, or what?
No,
have we stopped doing
we're
it?
still doing the educational piece, in the health department. I think part of it is that we're not poor like we were poor before, but we're poor. And we have poor housing. We have really a decline in the educational system. I mean, LaFleur County had an exceptional educational system big time. I mean, I remember getting with a superintendent, assistant superintendent. We did a lot of projects with the kids in the schools and exams and health education, health promotion. We even were doing, for the high schools, classes on sex. Now we had about 3 years of debate whether we can teach, sex in the schools, and there's the say no, and a major kind. And I was in the schools 30 years ago.
So actually, this whole discussion about abstinence or abstinence plus has been a barrier to communicating between the professionals and the potential patients. And that word is not getting out. That's one of the points.
The churches are letting me down, or letting us down, and the doctors too. I mean, unless the patient says they have a complaint that may trigger something in the private sector or at these community health centers, they don't get screened. And one of the problems that we have, why the black male is so outstanding, if you would, in numbers, is the fact that if you come to the health department for sexually transmitted disease problem, you're going to get tested for HIV. You come to the health department for prenatal care, you're going to be tested for HIV. You come to the health for family planning, you're going to be tested for HIV. So we're testing the black population, which is about 85 to 90% of the patients that we see in the health departments in the Delta. So, you're over testing. They're getting good care, and we're finding cases where the rest of the folks don't know what their status is. And that's one of the strategies that we've been trying to get going in this last year or so, is that everybody ought to, if they're sexually active, ought to be tested, once or twice a year.
After crying and all of that, I just got myself together and started thinking of a plan. I decided to come up with a health club, which I started at Tougaloo College last semester. And the health club is Tougaloo Health Peer Educators. Health stands for helping, educating, advising, learning, teaching, healing. And what we do, we're an awareness group on all diseases. So it's not just HIV, it's not just breast cancer, it's thyroid disease. We do different diseases each month. So that's what I decided to do. Instead of just sit back and blame everyone for my problems, I decided to take actions for my own problems and do something.
To be responsible.
Well, you have to understand, as a bisexual person myself, that still lay down with a woman that knows my story and that knows what I do outside of that household, truth will set you free. My name is Eric Lee Bailey. I'm from Bolton, Mississippi. I'm 34 years of age. I've been HIV positive for approximately 15 years now. Ole Miss, I will be at the LGBT Law Symposium, but I'll be there to talk about HIV in the state of Mississippi, encouraging people to go get tested, making sure that they have resources in the Delta area, Memphis area, and on back up to Jackson where they can go. I'll be providing phone numbers for them, I'll be telling my story, and I'll be taking questions and answers from some of the professors and or students that may be there at that particular time.
But when they run across my profile, it has my status, HIV positive.
And the next thing I know, I started going into advocacy work, then started being an advocate, which I started leading with the Mississippi Health Department with Caring Services. I became a community co-chair there. After that, I started working with Grace House, which is a transitional housing for people living with AIDS and or HIV.
What are the biggest myths about this?
Kissing. Oh my God, kissing. Really? You know how much saliva, how much longer a long kiss will have to be. You'll have to start kissing today, and then probably in 2020, you might have a little small strain to come through.
And you have to have some blood present. And it has to have a route. So it's not as simple to contract HIV as people think, but I don't want people to go out there and just be all willy-nilly, especially because there's some medications out there, because what we hear the most, we have medication.
Yeah,
I'm going to be good.
Well, then you have some stats from
I started doing this work volunteering in 2003.
These are stats from 2012, December 31st, 2012. The age group 13 to 24 with HIV disease, we have 561 new infections.
Didn't know my dad had died from complications due to AIDS. I thought he died from cirrhosis of the liver because he was an alcoholic. And to find that out, I knew then I was where I was supposed to be. And I just like helping people. I love helping people.
What I'm doing here today is actually to tell my testimony, my story on how to maintain a healthy lifestyle with HIV, because I always have to remind people HIV live with you. You don't live with HIV.
According to the Centers for Disease Control, the fourth largest number of all new HIV infections in the U.S. occurred among African American females with heterosexual contact. Vanessa Hassel is one of the thousands of women infected with HIV.
My name is Vanessa Hassel. I have been HIV positive since 1998. I am a peer counselor here at the Southeast Mississippi Rural Health Initiative Clinic here in Hattiesburg, Mississippi. I do rapid testing for potential people who may have been exposed to the virus. We meet with positive people and we give them a meal and we teach them about, living a positive life, being positive. In here, we're empowered. These are condoms. These can make the difference between HIV positive and HIV negative. And as a woman, we encourage them to get the condom. You gotta think outside the box. You don't wanna teach infidelity. No, we're not teaching it and we're not promoting it, but what we are is sending a message that you need to protect yourself. I worked at Forest General Hospital for 18 years. In that, I met a gentleman, and eventually we got married. I was switching jobs because I wanted to work 8-hour shifts so I could have more time at home. I had to do a physical for Hattiesburg Clinic. And that's when I found out that my test was positive. So initially I didn't tell anybody. And at the same time, when I was finding out that I was positive, my husband had some issues going on with his health. And so I kept insisting that you go to the doctor, go to the doctor. And so finally, when he went, I asked him just do a whole panel on him. He was HIV positive. He said he's in what they call the ARC. And that's a term that the old physicians used to use, where it's like right at the doorway for having AIDS. I tell people, when you marry, you don't know what all it entails. And the way I was raised was, it said for better, for worse, that means you had to be there. And so when it got worse, we just decided, well, we together, we gonna be together. I didn't go through blaming him or he blaming me, because overall I still loved him. And honestly, it could have been me that infected him, or it could have been him that infected me, because neither one of us were virgins. I just took him as he was. And so my love for him was real, because like he said, he always, before he left, he always told me, he said, I thank you for staying. I was thinking to myself, where was I going? I mean, I loved you. I loved you. So you were always good to me. You were always good to my kids. My family loved you. So, we're a team. And that's what we chose to do. Women need to understand that it can happen to them. We are not, elite from this. It can happen to you, because we as women, we love with our hearts. And that's one of the things that, I learned if we would have had the conversation. Because when a gentleman opens the door for you, or he does the things that you feel you need for that comfort, then you're not looking at, okay, where have you been? How is your past relationships? Those are questions that need to be asked. I mean, it doesn't make you less of a person, because sometimes men get on the defense about that, but as for women, you gotta love yourself. You gotta love yourself the most to say, I'm gonna ask these questions, because that one encounter can affect you for the rest of your life.
HIV is not a death sentence. According to the Mississippi Health Department, the number of deaths due to HIV disease has declined sharply due to the advent of highly active antiretroviral therapy introduced as treatment in the mid-1990s. However, living with HIV and AIDS does have its challenges. Today, we do have a panel of guests all living with HIV, and some have lived with it for a few months and others almost 2 decades. I want to thank you guys for coming, welcome you, and really thank you guys for coming in and sharing your stories. Now, we want to open up this discussion with a question. The number of cases has sharply increased among African American males between the ages of 13 and 29. Vanessa, why do you think that's so?
I think because a lot of our youth feel like they are invincible and that it cannot happen to them. And as we are positive, if we don't teach them, then they don't think it's real. They think it can happen to someone else when it's right there in our own neighborhoods. And with us not talking about it among ourselves or in the home, then I think that we're going to keep seeing our numbers increase.
Anybody else want to jump in? Cody, you're one of the younger guys.
I totally agree with what she's saying. I had that same mentality. When I was not positive, I used to, I guess, do whatever I wanted to because it's Superman syndrome. We're all Superman, we're all superheroes. We're not gonna get it until it's greatly like in our face and, affects us one-on-one. Otherwise, it's not, it's just something it's someone else, it's not us. It's never us, it's always that other person.
Wow. But it is you guys. Go ahead.
I think it's also not helpful, the mixed messages we're getting from the public health authorities, like the Department of Health and the CDC. They're de-emphasizing HIV at this point. So it's sending out the message HIV is not as important as it used to be. So there may be this sense of complacency.
Cedric, I want you to jump in right here and talk a little.
I was sitting here thinking, and a lot of our young people, there are a lot of issues and situations they have going on. For one, there's no sex education in the schools. So we need to get sex education back in the schools. A stigma, which really plays a big role. If some of these young African-American men are men who are having sex with men, then you're looking at that fear factor of where they, can't be themselves. So they may do it secretly and may not think about using protection.
Well, I want to ask Antoine, this number, 13 to 29, you're right smack dab in the middle of it. What are your thoughts?
Well, like everyone says, we always think that it can't happen to us, but when it really can. So who I think it will affect more is college students, because we, in that stage, and we just experiencing life, we just like, okay, I'm out my mom's house, so I can do what I want to do. So we messing around with everybody not thinking. So what I try to practice and teach the school is safe sex. Regardless, females or males, you can use condoms. You're old enough, you can buy cigarettes, you can do everything else, so let's go buy condoms.
You talked about college students. Marcus, that's you.
Yes.
Talk a little bit about your thoughts.
Just to add to what Antoine and pretty much everyone else has been saying, as far as in young people not thinking that it could happen to them, I've talked to several people. A lot of people don't think that it could ever happen to them. I was one of those people. And then you also have this group that believes that because they are gay, because they are black, because they're female, that they're going to eventually get it. So they don't try to practice those safe sex practices that could possibly reduce their chances of getting it.
Do you find that it's hard to talk to people in your family about your diagnosis, about your status? Robin, what about you? Is your dad as a pastor?
Yes, my dad he's deceased, was a Southern Baptist minister and very embracing of my own story back in the late 80s, as was my mother and my entire family. But it didn't change the fact that it's extremely difficult conversation to have. And I think it also brings up the subject of religion in relation to HIV and how the church, we have that opportunity and invitation now in our churches. No one who becomes HIV positive or has a diagnosis wants to get kicked out of a church or not be able to turn to their pastor or turn to their spiritual source for help.
Robin was saying, we need the church where, there's a place that we ought to be able to go and not be judged. And if, and until people get that in their mind that, the church is for all. I mean, Jesus went among all, he didn't go to the people that were in the church, he went to the people that were not in the church because they're the one needed it. So if I'm coming to you, I don't want you beating me up when I get there.
As you say, with the church, the church, especially here in the Deep South, really need to realize that, hey, the church is supposed to be a place for healing of all illness. And that's just not, the physical illness, but also the mental illness, the whole thing. And the churches in the South, some of them are basically slowly coming around, but you shouldn't shun a person because of their sexual orientation, their HIV status, or anything.
Well, let me ask this. I'm going to switch gears just a little bit. In addition to the African-American men that are contracting HIV, there's also African-American women. And oftentimes, in many cases, these are women whose male partners may also have other male partners. Eric, do you want to talk a little bit about that? Talk a little bit about the down low. Can you address that?
Me personally, I don't believe there's a such word.
I was going to say, do you even think there's a thing,
there's
such
not
thing?
a such word, because let me tell you about the gay community, what they do. If they call it trade, wherever they got that word or that terminology from, they can just sweep that up under the rug because they talk a lot. And you heard that a lot from everybody on this panel, how people talk. When you go inside the house with a gay person, especially one that identifies themselves as a sissy, they are gonna sit there and they're gonna tell your business as soon as you walk out that door. So there's no such thing as down low, because once you cross over to that, you may be bisexual, but you're not on no down low.
Okay. Vanessa, you're a black woman. What are your thoughts?
I say for the women, we have to take responsibility for our part in this. It's not just a one-sided thing. You can't just fault him at, for that and for his foot. Bi-curious, I guess they say. But know what your man doing. Check him if you need to check him.
I kind of want to weigh in on the.
I was kind of coming back to you on that, but since you stepped back in, go ahead.
Well, and we have to look at a lot of other factors with the guys. I'm like Eric, the down low,
You don't believe in it?
That's not, even because there are some guys who may only have sex with guys and still don't want to be identified as gay.
Well, then what are you identified as if you only have sex with guys?
They just say they like what they like. And you also have guys who use sex for survival. I guess one of the reasons why they say men will have sex with men, to identify if you have sex with men, to not just say, okay, he's gay, he's bi, or he's DL, or any of that, but just to characterize a man who has sex with men, whether he's just having it with women or if he's experiencing anything, or, any of that.
Now, you're from the Delta.
I'm from the Delta.
And Cody, you're from the Delta.
Yes.
What is it about is it hard to come out as a gay man, or what's going on?
Well, I think we can both agree on this. It's lack of education, and then you have these people that are extreme Bible pushers. And again, if you're being gay is a sin, and that also plays into the DL thing. A lot of that problem is guys do not want to say they're having sex with men because it's considered a sin, and people are going to talk about it.
Well, and let me wrap this up, but I want to ask you guys, you guys are all living with HIV, living with AIDS. You look wonderful, you're healthy, you're outgoing, advocating in the community. What do you want to say to people about living with HIV, AIDS? What do you want to say to them to educate them about what you guys have gone through, your journey, and what they can do?
I just want them to get tested, get educated, and hold these organizations that's out there doing the work accountable for the money that they're receiving.
We are HIV positive, and some of us have been diagnosed with AIDS, but we do have lives, we have feelings, we have goals, aspirations, we want to get places. We're just not just our HIV status.
In this day and age, we as individuals are all responsible for making our own choices to what happens to our own bodies, and nobody else. We can't blame it on anybody else. We can't, except in cases of violence and rape, we can't. We've got to take ownership of our own choices in terms of staying away from HIV infection.
Well, that's all the time we have. Please visit Southern Remedy at mpbonline.org for extended interviews and clips.
From all of us at Southern Remedy, good night.
Southern Remedy is funded in part by a grant from the University of Mississippi Medical Center.